Good morning, I'm Dr. Deuk at Deuk Spine Institute, and I have one of my lovely patients and his wife from Canada, right?
Good morning.
Alberta. And what are you doing here today?
I came here because I was unable to access minimally invasive spine surgery in the country where I live. And I'm a board certified pain specialist, and I just have seen so many surgical complications from patients who have open spine surgery. Approximately 25% of the patients in my clinic are there only because of the surgery, not because of the thing that they went for the surgery for. They're there because of surgical complications. So I came here in seek of a better way to have my spine fixed. It's that simple.
And you had watched some of our surgeries before you came here?
I've watched your surgeries. I've had sent patients to a place called the Laser Spine Center in
Tampa?
No, this was
Up
in
in Buffalo?
Scottsdale,
Okay.
but they were bankrupt. And I've followed you for quite a while, actually.
So you said, I like what this guy's doing, minimally invasive, he seems to have good results. I have the same kind of problem with your back, correct?
Yes.
You came for your lower back.
Yes.
And you decided to come out here and see what it's all about. So you actually jumped in the pool. You didn't put your toes in. You jumped full scale. You showed up and had, what did you have done?
I had a 3-level disc repair done percutaneously in the lumbar region, so the lower 3 lumbar spines, the discs, the cushions between the 3 lower spines were degenerating and were causing significant amount of problem with the nerves that go from there to my legs, so that I was having 2 major issues. One was pain in the back, so pain what we call axial back pain, and then I had quite severe weakness in my right leg, so I was falling fairly often.
And you talk about, you said you had, as in past tense, but you just had surgery yesterday, right? Less than 24 hours ago, about 24 hours ago. What do you mean by had?
I have 0 pain today.
So your pain's gone.
0. No, gone. It's 0. I mean, in a pain world, when I'm a pain specialist, I never hear a patient say they have 0 pain.
We hear it all the time. We're used to it.
I don't hear that.
But some people get upset when I mention the word cure. But do you think curing back pain now, do you believe it's possible?
I do. This is not something I'm familiar with, even though I understand the theory of why it could happen. Most of the surgery that I see done does so much damage in the process of fixing the problem.
Correct.
That it becomes a double-edged sword.
It's
So you
collateral
don't think of cure.
Yeah, it's incredible. So this surgery really is incredible. That's why I think it's literally going to be what the standard of care is all around the world for fixing herniated disc, bulging disc, back pain, neck pain. It's going to be once surgeons learn how to do it. The problem is getting them to learn how to do it. So prior to surgery, you were having back pain, you were having right leg pain and weakness. Right leg, correct? Was it your right leg?
Yes, my right leg.
Right leg. And now that's all resolved.
I have no pain in my back at all. The right leg is still weak, and it's going to remain weak for probably 2 years till we get remyelination.
That's correct.
Correction of those nerves. That's predictable. I'm happy with that. I understand the science there.
Good point. Yeah. So, is there anything else you want to tell our viewers?
I just want to say one thing, and I don't understand this. I don't understand why this is not the standard of care. I remember back in the 1980s when laparoscopic cholecystectomy replaced open cholecystectomy. It was a sea change in general surgery. This is a sea change as well, and what I don't understand is why that sea change isn't happening. I have a feeling, and it may be just me, that I think there's a massive amount of money invested in the instrumentation for doing open spine surgery, whereas in cholecystectomy there was no money other than sutures. When it come to laparoscopic cholecystectomy, there was a huge group of people supporting the endoscopic industry, and there was an industry of equipment and technology that was supporting it. Here, it seems to be that the industry and technology is opposing it, and I don't understand why everybody who needs surgery. In my place where I practice, I have patients who have developed weakness, and weakness is a surgical emergency, and they wait 2 years before they get a microdiscectomy done. I can't help but thinking that's criminal, Dr. Deuk. I'm very unhappy with it. It saddens me every day to sit and see these patients where I can do nothing. Oh, I can put in some steroids and I can do some PRP around those nerve roots to try to help them a little bit, but there's nothing I can do to change the pain pathology.
No, you're correct. If there's weakness especially, that's an indication for urgent surgery immediately, like within a week at most, preferably within 24 hours. So you're correct, that should not be being done. However, unfortunately, I don't think all the physicians out there are doing what's in the best interest of the patient. I feel like there's a lot of physicians that do what's in their own best interest. And maybe they don't have block time at the hospital, maybe they're on vacation, maybe they're leaving town. I don't know, they have an excuse for not actually doing what's right for the patient. At Deuk Spine, we don't make those excuses. We do what's always best for the patient. We do our very best for our patient every single time. So.
It's a wonderful facility, thank you.
Thank you. Safe travels back home.
Can I say one more thing?
Yes, of course.
When I was laying on the table yesterday, I went and listened to the talk later, and you said something that pain specialists like myself are just so passionate about, and that is the biopsychosocial model of pain. The pain affects your job, your wife, your loved ones, and everybody around you, your entire society. It's not just my pain, it's everybody's pain. And I clearly know that in your heart, you know that.
Yes, I do. I've seen it. I've seen it in all my patients. And it saddens me to see the negative impact that pain has, chronic pain has, on people's lives. Not just the patient, but everyone that cares for them. When my wife has a headache, right, I feel horrible for her and I want to do something to make it go away. And when you can't give them a pill to make it go away, if you can't do something to make it go away, you suffer with that person and it's on your mind and it affects everyone. And so yeah, I think chronic pain is a big, big deal. It's, in my opinion, one of the biggest issues in medicine that needs to be tackled socially as well.
Socially.
And we need more support from our government to support it because insurance companies don't want to pay for chronic pain curing or treatment. They just see it as something that eats into their profits. And that's unfortunate because they're not supposed to be looking at paying for benefits that way. They're supposed to be looking at, we're here to manage people's benefits so they do get the care they need that the doctor recommends. We're here to pay the bills and help coordinate your care, facilitate your care, not obstruct your care and not deny your care. And that's where we've migrated to in the United States. Insurance companies pull all the strings, they control everything, and they're basically restricting access to care for people who need it. So I'm hoping someday that changes and that everyone will have access to this type of surgery, the Deuk laser disc repair that you had done, and that we can really make the world a better place.
Can't thank you enough.
My pleasure, sir. It's an honor.
Thank you
to
so
I
take
think my wife's the one who probably really thanks you. She has to listen to me.
Take care.